Hi everyone, I am Beatrice. If a patient has ever asked you, so what is this medication actually used for? And you smile while panicking inside, you are not alone. This video is for you. The new grad student, you can relate to what I'm saying. Now, go ahead, hit the subscribe button so that you don't have to freeze up or mess again. Let's begin. So today, we're going to look at oral diabetes medication that are used for treating type 2 diabetes mellitus. Now, we're not going to look at all the classes, but we'll just focus on about 5 classes that are commonly tested in your exams. Now, the first one is sulfonylureas. Their mode of action is simple. They increase the release of insulin from the pancreas. So they are like helping the pancreas do the work of releasing insulin so that it can act on those glucose. Example of medication in this class include medication like glipizide, glimepiride, even glibenclamide, that popular medication we call Dionine. We also have other medication like glypuride. So the side effects include things like hypoglycemia. Now we know that, of course, hypoglycemia is going to be a general side effect of all anti-diabetic medication based on the mode of action. But it's more unique to this class of medication and even the medicinite because they have the same mode of action. Another side effect that is unique to sulfonylureas is photosensitivity. So because of this, when you are teaching patients about what to watch out for, you can tell them to wear sunscreen to reduce that exposure. And then another thing, of course, is GI upset. It's unique to the sulfonylureas. Now, contraindications, suffer allergy, even kidney and liver disease. Teaching for these patients, like I mentioned, you're going to teach them to wear sunscreen if they are on this medication. They should take this medication 30 minutes before meal and no alcohol at all, because alcohol, when it acts together with this medication, it can worsen hypoglycemia. So you want to take note of that and teach patients about this. The second class of medication we'll be looking at is the medicinite. This medication has the same mode of action like the sulfonylureas, so meaning they increase the release of insulin from the pancreas. Example of medication in this class include medication like repaglinite and nataglinite. So most of those medications that end with nite from the name medicinite. So you can easily predict the name when you see it. Now the side effect, the first one is going to be hypoglycemia because they have the same mode of action with the other group. Now, but the unique one about medicinite is angina or chest pain. So they could feel that chest discomfort. So when you are teaching them, tell them to watch out for chest pain because it could be a side effect. Part of the teaching also is to tell them to eat within 30 minutes of taking this medication because of that hypoglycemia that is so unique with this medication and the other sulfonylureas class of medications. If you are enjoying this video, please, I want you to hit the subscribe button if you have not done so, and also leave your comments. The third class of medication I want you to know is the big one nights. The popular medication we know, Metformin, which is most times the one that is used as a first-line treatment for diabetes mellitus type 2. Now, the mode of action of big one nights, the first thing is that it decreases glucose storage and production by the liver. And also, it encourages the reuptake of glucose by the cell, so it reduces that insulin resistance. Side effects. There are some unique side effects I want you to know about the big one and metformin. One of them is lactic acidosis. And then another one, we have metallic taste. There's this feeling of metallic taste. So you want to teach them about that. It can lead to vitamin B12 deficiency when you use it on a long period of time for prolonged use. And then GI upset is also common with the big one nights. Now, something so important again that you need to teach the patient about this medication. One is no alcohol because it's going to worsen the hypoglycemia. Another thing, you're going to teach them to take it with meal because of the risk of hypoglycemia. Now, the most important thing you need to know about big one nights, even if you can't remember any other thing about metformin, is when a patient is going for diagnostic procedure, let's say they are going for CT scan that involve the use of contrast dye, the medication should be placed on hold. They should be discontinued for 48 hours before the procedure and 48 hours after. And that is because of risk of increased lactic acidosis that can lead to acute kidney failure. That's so important, you need to take note of that. Now, the next class is what we call DPP4 inhibitors. This group of medication, mode of action is decreasing glucagon release and increasing insulin secretion. Examples are sitagliptin, sazagliptin, all those medications that end with gliptin. They are in the group of DPP4 inhibitors. Teachings. We are going to teach them to take this medication daily, with or without food. That's because the risk of hypoglycemia is not so serious with this group of medication. But the unique thing you need to know about DPP4 inhibitors is that it can cause pancreatitis. So you need to tell the patient when they have this medication to watch out for some of those signs and symptoms. All those abdominal pain, severe nausea, fever, any of those symptoms that relate to pancreatitis, this medication can cause it. So you want to teach the patient about signs of pancreatitis. The last group of medication I want you to know for the sake of your exam is the sodium glucose cotransporter 2 inhibitors, what we call the SGLT2 inhibitors. This medication, their mode of action is just to block the reabsorption of glucose by the kidney. You know, in the kidney, in the nephron of the kidney, when you look at the mechanism with which urine is produced, glucose is reabsorbed in those tubules, the convoluted tubules, especially the proximal convoluted tubules. When you give this medication, it's going to act on that nephron. It will stop the reabsorption of glucose back into the blood, meaning it's going to increase the excretion of glucose in the urine, what we call glucosuria. Examples include dapagliflozin and empagliflozin. So all those medications that end with flozin, they're in this group of SGLT2 inhibitors. Teaching. This medication, now you know it's going to work, it works on the kidney. And because it's going to cause glucosuria, where you urinate a lot of glucose in the urine, of course, the risk factor is going to be dehydration. So you're going to tell them that this medication can cause dehydration. That means that they need to stay hydrated a lot so that they don't become too dehydrated. Finally, there are some medications that can also affect blood glucose. Either it's increasing blood glucose or decreasing blood glucose. Some of those medications include beta blockers. So for beta blockers, it's not like it's going to work on the glucose and reduce it, but it's going to mask the sign of hypoglycemia. Things like increased heart rate, that feeling of and that anxiety, palpitation, sweating. So some of those things you won't see it because the patient is already on beta blocker. Beta blocker lower the heart rate. So you want to teach patients when they are on beta blocker, they should still check their blood glucose to be sure they are not at risk of hypoglycemia. Other medication, basically these ones they cause hyperglycemia, include thiazide, the loop diuretics, even corticosteroid can lead to hyperglycemia. So that wraps up today's topic on oral diabetes medication. If you find this video helpful, please like this video, share this video to those that will need it, and hit the subscribe button. Also leave your comments. Thanks for watching.